Sunana Comfort Isha na fita daga kurkuku na za su to. Da rana da na ji ciwon wannan shi na ce to mai gidan ta ce to mu kama shirin mu wuce asibiti. Mai gidan ta ce to tunda tana da mashin wuri ta doke ni shi ne ta doke ni mu za asibiti. Da mu za asibiti to masu likita kuma ba za ta tambaye shi ya ne su riga su sani shi ne mu wuce a gudu. Na zo ba ruwa a asibiti. Inda ba ruwa mutum da ta sa da ni, mutum da ma ta je numa ruwa. Kafin da ta dawo, yaro ya fita ba ruwa. Sai lokacin da ruwa ya zo, shi na kama yaro da.
When a woman in labor came to the facility, what we used to do is that when the woman came, one person will be attending to the woman, and another person will be rushing to get water before the baby comes out.
Abuja, the Federal Capital Territory of Nigeria, is home to an estimated 3.6 million people, and a significant number of this population visit healthcare facilities daily. However, according to the 2021 Water, Sanitation and Hygiene National Outcome Routine Mapping Survey, 91% of healthcare facilities in the capital lack clean water, decent toilets, and good hygiene.
There is no toilet in the hospital. When I came for hospital, sometimes we are going to bush and it's not good like that.
We lack water, we lack toilet. Even the patient, when the patient visited our clinic, very difficult to go to toilet. At times they used to go through the bush, and even water to clean themselves is a problem.
Nobody goes to a healthcare facility to get sick. Yet, millions of people across Nigeria risk contracting infections and diseases when they seek care because doctors and nurses attending to them don't have clean water to wash their hands at points of care.
Before, if you just turn it like this, the water will start rushing. But because there is no water, lack of water, we cannot wash our hands. So if you people can help us to talk to with water board.
Across the country, primary healthcare facilities are more disadvantaged than secondary facilities.
Healthcare workers are faced each day with the occupational hazard of picking up infectious diseases when they are unable to wash their hands after interacting with patients. This is very demotivating for them, and it makes it difficult for them to get their work done. In various circumstances, they are expected to also fetch water to take care of the needs of patients, which puts additional burdens on them.
Inadequate water, sanitation and hygiene services in healthcare facilities compromises the safety of patients, helps infections spread faster, and increases the risks of hospital-acquired infections, putting staff, caregivers, and vulnerable patients in danger. It also contributes to undesirable maternal, infant, and child health outcomes in communities.
Patients come with diarrhea and vomit. They have to start rushing to the bush. Even we start, once we are pressed, we have to start going back home.
In fact, this hospital clinic is not in a good condition. So we need government's help. Was it not 2 months ago? Then I was sick. So they brought me here. I have to be defecating in those rubber for them to throw away. There's no toilet, no good equipment. It's very bad.
No healthcare center should run without access to clean water, decent toilets, and good hygiene, no matter how small or how remotely located they are. However, in a lot of healthcare centers in Nigeria, this is sadly the case. WaterAid and our partners believe this must change.
One of the key principles of healthcare delivery is do no harm. When there is inadequate water, sanitation, and hygiene facilities available, it compromises the ability to uphold this principle.
There's nowhere more important, particularly where people are sick in a healthcare facility, that is where people really should be hand washing. So these places should be exemplary.
Many healthcare facilities need to be upgraded in terms of infrastructural development to ensure that the water is running all the time, soaps are available for washing of hands as when due.
Even though during the pandemic there were provision of soap, Veronica buckets, when you get to some of those facilities now, those buckets are empty.
Shockingly, 41% of healthcare facilities in Nigeria do not have basic water supply services, 88% do not have decent toilets, and 70% lack basic hygiene services.
Water, we all know the essential aspect of water, especially in primary health care. Now we are in era of COVID-19, and we don't have source of water here in KKC primary health care. So what comes of us, the staff, no talk of the community as a whole?
Research has shown that some healthcare workers also have limited knowledge of appropriate hygiene practices and opportunities.
So the only challenge right now is we not having much training for this job because it's needful.
Sometimes when I came, I will enter the ward. Sometimes you see dirty anyhow. I gather it. I used to tie it. After tying it, you go and throw it away in the dustbin there. Because we have the boiler here near us.
Cleanliness is essential within a hospital environment, not only within the wards, but in operating theaters and all public areas including waiting rooms, toilet facilities, and cafeterias. For this healthcare facility in Beijing, water, sanitation, and hygiene facilities have been provided, but more needs to be done.
For the past 5 years that I've been in this place, the impact has been there. So the issue of water in Biaji is no longer a challenge. Immunization side, any client they wanted to attend to must surely be on PP. We have water there running with hand sanitizer.
The COVID-19 pandemic, though a devastating event, has highlighted the need for effective disease prevention and control measures. The call for improved water, sanitation and hygiene services in healthcare facilities as a first line of defense against future outbreaks is now more urgent than ever. The Federal Ministry of Health, through the National Primary Healthcare Development Agency, developed technical guidelines for water, sanitation and hygiene in primary healthcare centers in 2016. However, low implementation, inadequate funding, and lack of dedicated budgets for installation, operations, and maintenance of facilities has resulted in ineffective implementation. The FCT Primary Healthcare Board has also continued to make efforts to ensure that primary healthcare facilities in Abuja are provided with adequate wash facilities. But the statistics indicate that much more is required to achieve maximum results.
The major way we intervene was to support the construction of facilities. We call it service delivery, where we actually ensured that in some primary health care facilities, especially in some states where we work, we actually supported the construction of hand washing stations. Now this is just for hand washing, but for toilets you require longest time investment. So we supported to ensure that there are facilities for hand washing in strategic locations in primary healthcare centers in these states. And that's to ensure that when you are going in and you are coming out, in places where you have maternal care and you have mothers coming for immunization, people are able to wash their hands with soap and clean water.
We have hand washing in the facility. As you can see, we have one outside for the patient that come into the facility. We have a bucket and a liquid soap there that we ask them to wash their hands. We have a running tap in the lab. The people working in the lab, after they finish, they can wash their hands.
I'm happy that the world has come to appreciate the importance of wash. And I believe that the world will also be ready to invest in the wash domain now.
Until enough attention is given to the issue from the government and the public health community, far too many people will remain vulnerable to communicable diseases, future pandemics, and avoidable fatalities. Government must accelerate progress towards hand hygiene for all and urgently scale up sustainable, safe, inclusive, gender-responsive water, sanitation and hygiene facilities and services in healthcare centers. The recently launched guidelines is a starting point. This must be followed up with effective implementation. Water, sanitation and hygiene must be integrated into regular health sector planning, budgeting and programming to deliver quality service. There must be dedicated budgets and staffing for operations and maintenance of wash facilities in healthcare centers. This must include the provision of uninterrupted water supply, reticulated to all points of care, toilet facilities that are functional, always clean and accessible to all, including persons with disabilities. The current health crisis must be the turning point for hygiene prioritization and investment. The time to act is now.